Good evening. Welcome to this training session. In this training session, we are going to have a look at, give a overview of nursing care plan. First of all, I would like to introduce myself. My name is Jyothy. I just a bit about myself. I did my initial nursing course in India. That was back in 2004, finished in 2008. Came to Australia in 2010. I did my post-registration in nursing through Ballarat University, which is now called as Federation University. Since then, I did a short stint in 2 aged cares in Melbourne before moving to mental health sector, where I worked for 10 years. I really enjoyed working in mental health sector. From that, I moved on to correctional mental health nursing. During this time, I discovered my passion in teaching and mentoring, and that's the reason how I've reached here. So I'm just following my passion in teaching. Hope you enjoy this training session as well. Would you like to introduce yourself?
Yeah, my name is Jyothy. I'm currently working as a healthcare worker at nearby hospital. I have enrolled myself in to become an enrolled nurse. So, I would like to complete this course and be a good nurse.
Wonderful. So you do have some exposure into healthcare field.
Yes, of course.
Yeah, that's good. So let's just have a look at what we already know, like what we see in our real life in a clinical setting, and then we'll start from there. We'll first look into what we already know.
Okay.
Yeah. And then we'll see, we can try and try and relate the new information into the old information and then go from there.
Yeah, sure.
Okay. Just wanted to show you a video. It's just a short video. This video shows about the different types of patients, or the different types. It's not really a nursing video, but it actually shows the feelings and emotions of people that usually you see in a hospital or in any clinical care setting. You might have seen such feelings or emotions in aged care homes as well. How did you find that video?
Yeah,
It is quite a touching
yes.
video, isn't it? You can see many sort of emotions there, people going
Happening
through
the same
happiness
place.
or
Yeah.
excitement or sadness or hopelessness, and sometimes it can be just numb. You can't see any sort of emotions in their face either.
Yeah.
They are worried about their future, or it's just it's too much to handle. So nurses do go through many of those situations, isn't it? Like they try and help patients in going through many sort of emotions. So that's I think that's a really good example to show what nursing is all about. This is what we've got. This is what we handle and manage every day. So just wanted to when you look into that video, I just wanted your perception of what you would deduct when you see someone from their face. Like you may not be able to get, everyone may not tell you what's in their mind, isn't it? You're going into a patient's room and she's sitting, she's probably crying. What do you deduct from it? What do you understand from it? So I just wanted to do a little activity just to know your perception of how you deduct from a person, what you deduct from a person. So I'll just give you, did I actually not do that already? Okay. I'll just give you 3 pictures. There we go. Just have a look at them, and in this paper, if you can note down what you understand from it. So we'll do one together first, and then let's do one together and have a look. By this activity, what I'm trying to do is to give you a skeleton of nursing care plan. This is the topic. This is the topic of our day. Okay. So what do you think from this picture? What is your initial observation? What is she doing?
She looks happy. I think she's in.
She's smiling. She's smiling. That's what we see, isn't it? Yes. A lady is sitting there. She's smiling. She's sitting with her friends. That's what we see.
Yeah.
That's the assessment part.
Okay.
You assess a patient, either what they hear, what you hear from them, like what they are saying, or you might assess, which is called the subjective. So the objective assessment is what we see. What we see. So what we see in this picture is that she's sitting there, she's sitting with her friends, she's smiling.
Yeah.
That is the objective assessment. If you could hear what she was trying to tell us, that becomes the subjective assessment. So you're assessing someone from their perspective, from what they say about themselves. So anyway, this is the assessment part. Then comes, so that's, if you could write it there, that the lady is smiling, isn't it? That's one of the assessments that we can make from this. The lady is smiling, she's sitting with her friends or family. And then from that assessment, what diagnosis can we make? That smiling we can deduct it as happiness. She's happy.
She's happy.
Isn't it? Like she's happy. From that assessment, we are coming to a conclusion that she's happy. She's probably, why is she happy? She's probably having a fun time with her family and friends. She's probably in an aged care home having a happy hour. Doing some good, happy activities with her. Exactly. So that's the nursing diagnosis, that she's happy. She's happy. That's what we can put it there, isn't it? So the first part of a nursing care plan was assessment, and the second part is diagnosis. Okay, so now we don't have to go and change that happiness from her. What can we do? We can share that happiness with her, or we can help her to keep that happy time a bit more longer, or we can be with her at that time, make it a bit more memorable experience, isn't it? So the planning bit, that's the planning bit. We plan. What's our plan? What's the goal? To share happiness. We can put it there as to share her happiness. What do you think about it?
Yes,
Share her happiness. Yeah. Now we think about, so we made a goal. We have to implement that goal. We have to do things to reach that outcome, isn't it? So what can we do? We can sit with her, we can take her for a walk, we can plan like games or activities or something, so that so the implementation, how can we implement? Like we can take her for a walk, have a coffee with her, or do activities with her.
Or maybe, her hobby, just...
Exactly. Ask her what her hobbies are, and we can sit with her and try and be a part of it, isn't it? Or contribute in any way we can. So that's the implementation part of that. How do we evaluate? How can we evaluate what we did? Unless and until we can always find something, we can always plan things and implement things. If we don't evaluate, how will we know what we did was good or not, what we did worked out or not? So we have to evaluate what we did. How can we evaluate the implementation?
We can just, spend time with her and see how she goes.
You can ask her for feedback, isn't it? So asking her feedback is an excellent, if you could, it might be, if someone can tell you verbally that, I'm happy now. What you did
because
helped me.
If she's cognitive, she will let you know.
Exactly.
And she will looking for, another time
Like that with us, isn't it? So that's evaluation, asking for feedback, isn't it? Or you see her happy, or you, or she tells you that, yes, I had a great time and I would like to have it again. You know? So that's the evaluation part of it. So does that help in nursing? Can you relate it to clinical nursing? So nursing care plan is not just a paper thing. You can always use that in, this is real nursing to us, isn't it? So let's have a look at the pictures that I just gave you. What do you think about this picture? What do you see? What do you think is the assessment part of this picture?
Yeah, she looked worried. Maybe she's shocked by hearing something.
Yeah, so the first assessment is that she's crying, isn't it? She's crying, she's holding her hands up her mouth. That's what you're seeing.
And her eyebrows.
Eyebrows are frowned, like her forehead is frowned, isn't it? So that's the assessment part. So you can put that in the assessment part, that her forehead is frowned, she's crying. Why would that be so? Why do you think she's crying?
Maybe some unexpected news.
Bad news. Obviously, that looks like a bad news, isn't it? So it's an unexpected bad news. That can be the nursing diagnosis.
Okay.
There you go. What do you think? What can we do about it? Like what can we do for this person? We are not talking about the activities now. We're talking about the end result, what we want at the end of the activities. What's our goal? To
just make her comfortable.
To make her, we may not be able to make her happy,
but at least we know what's wrong with her, and try to
be for her and make her a bit comfortable, isn't it? Make her comfortable. That's the planning. That's the goal of what we are about to do. And then what can we do about that? We can maybe sit with her and reassure her. Yes. Yeah. We can ask her about what's going on in her mind. If she's happy to talk about it, let she talk about it. Give her
time.
Spend time with her. So we spend time with her. We can sit with her. Give her a leaning shoulder, isn't it? So that can be the implementation part. And how can we evaluate what we did? maybe one, do you think if you see her crying out loud, that may be an evaluation too? Like, yeah,
It's always good to, burst,
show the
that
emotions
emotions.
rather than
Keep it herself.
bottling it inside. If she is able to show it outside, if she is able to bring her bottled up emotions outside, then that can be an evaluation. Or if she verbalizes to us that, that helped me, that conversation that you had with me, that was helpful, that's great, isn't it? At the end of the day, if you get a feedback from a person, that's the best evaluation that you can have. So that's there. How about that's just the these pictures are also, when you get some time, if you could go through that.
Sure.
It just shows you different perceptions. Your perception and my perception may be totally different.
Yes.
But it just gives you some ideas about how real life clinical scenarios can be, isn't it? It's not just about paperwork. It's not just about what we learn in books and classes. These are the real scenarios that we can
we go through
in nursing. Can we? So now just to go through what we did. What are the different components of nursing care plan that we just went through? The first one is assessment part, then comes the diagnosis, then comes the planning, implementation, and at the end of the day it is evaluation. Can we do a quick quiz just to see what we understood from this? Okay. It's not a difficult one. It's just the main things that we actually went through before. All right. Would you like to read it loud for me, please?
The nurse completes a thorough assessment of a patient and identifies a nursing diagnosis. Which step will the nurse take next in the nursing care plan?
So in this, what has she done first? She did the assessment part. What did she do next?
The diagnosis.
She made a diagnosis. What can be the next one?
Next one will be planning.
Planning. So the planning. Happy with that answer?
Sure.
There you go. That's planning. Okay, the second one. I'll read that loud.
Okay.
A patient states, I have a terrible headache. You observe him rubbing his forehead and having facial grimaces. Which part of nursing care plan is this? So what are we seeing here?
He's having headaches.
He's stating that he has a headache. What's that? That's the subjective assessment. You are asking a patient, or you're seeing a patient and he's already telling you that he has a terrible headache. So the subjective assessment was, he's saying he has a headache. The objective assessment is you're seeing him rubbing his forehead. Which part of the nursing care plan is this?
Assessment.
Assessment part. Yeah? There you go, assessment. Would you like to read that?
A 10-year-old patient is admitted in medical ward with a diagnosis of pneumonia. What nursing implementations can be used to support the patient? A. Tell the patient that everything will be alright. B. Educate and support to do deep breathing and coughing exercises. C. Tell the parents that they shouldn't have let their son in the rain. D. Suggest the family a medicine that has helped you in the past. I think it's B. Educate and support to do deep breathing and coughing exercise.
Do you think it's a really good idea to tell the parents that they shouldn't have let the son out in the rain?
Not at all.
That's not our call at all, isn't it? We are not there to blame them of what they did. We have a patient in our hand that has this issue. We use our knowledge, we use our experience, and then try and educate on how to improve that situation. Yes. So educate and support to do
deep breathing and coughing.
There we go. Exercises. What's the fourth one? I'll read the fourth one. You document that the patient's oxygen saturation has improved from 92% to 96% in room A. From the first sentence, what do we understand?
Already, you
It was.
Yes.
Yes. And what did we find? The oxygen saturation was
dropped, and now it is.
Yeah. At the time it was 92.
And now it's 96.
We did something, then it became 96. Audible wheezing was present. It's not present currently, which means it was present before. Which part of the nursing care plan is the statement? Audible wheezing was not present. It's not present currently. So we did something.
Yeah, we did something, and I think it's evaluation. So we are evaluating.
Exactly.
Yeah.
So we got an answer. We got an outcome of what we did. There you go. Yeah. That's evaluation. Would you like to read that?
You are allocated a patient diagnosed with gout. The patient is having decreased mobility issues. What are the possible steps in planning stage of NCP?
NCP is
nursing care plan.
Yeah.
A. The patient will start walking by the end of the day. No.
That's not a real.
B. The patient can use the buzzer whenever necessary. That's not
really a good outcome either. That's just putting all the responsibility on one person, isn't it? Rather than there is nothing for you to do in that scenario.
C. Increase the mobility level by the end of the day. D. Educate active and passive mobility exercise.
What's your opinion about the answer D? Educate active and passive mobility exercises.
It doesn't, it's at the end, like it's not a planning stage.
Yes, it is a implementation stage, isn't it?
Yeah.
So what can be the answer?
Looks like increase the mobility level by the end of the day.
That's right. It doesn't have to be like the person is up and walking about. It can be just a slight improvement of what you saw in the beginning of the day, isn't it? So increase the mobility level by the end of the day.
Yeah.
Yes, there you go. Well done. There you go. So can we just go through what we learned today? So basically what we formulated a skeleton of nursing care plan, isn't it? Can you just say what are the components of nursing care plan?
First is assessment, nursing diagnosis, then we have to plan, then implement, at the end evaluate
what we did, isn't it? And we did go through a few scenarios as well, just to relate it back to the real life, isn't it? No, it's not the words. You have to be able to relate it to our real life, to stay it inside, isn't it?
Yes.
So those are a few examples of what we went through. When you get a chance, can you take some time to fill that? It's just a quick description, just in a few sentences. Write down in a few words an encounter you had with a good nurse. Okay. Or you can say it as well. Have you ever had an encounter with you thought that, oh yeah, that was a really good nurse? Or what was the characteristics of that nurse?
Yeah, I've gone through, one situation where, when my son was born, you see different nurses in different time, but then someone was so good to me, at that time, I understood that, she was caring, she was, following all the instructions and helping me out, and she knows what I'm going through.
Yes.
Yeah. And then, that was really good, you just felt supportive,
in your vulnerable moment.
Yeah, that's true.
Isn't it? You were really vulnerable.
Being a mom first time.
Exactly.
You don't know, you haven't gone through that before. So at that time, she knows what we are going through, and then she supported. So still I can remember her.
Yes.
Yeah.
So that's an empathy. She was standing in your shoes and
she was
understanding rather than having a prejudgment. She was understanding or asking you what you're going through and was there for you.
And sometimes it's not only what we say. She can see, as you say, you see some people and you know what they're going through.
Exactly.
And then instead of we asking, she knows what we need.
That's really good. So in that scenario, what you just explained, what the points that highlighted from what you said was that she was compassionate,
And
isn't
a
it?
good listener.
She is a good listener. She is empathetic. And then would you say she was knowledgeable as well? She was helping you. If she would,
I
if
think
she
that
didn't
was the
know,
base thing. Like
exactly.
she knows what she's doing. She's good in, with her skill.
Okay, yeah. So if she doesn't know what she's supposed to do, she wouldn't be as confident.
Yeah,
or you won't be even able to trust her, in her help, isn't it? You also felt that she's confident in her, and her knowledge is really good in what she's doing. So those are some of the. Would you say that those are some of the good characteristics in a nurse? And those nurses, you can probably, when you look into what they actually, how they perform their nursing duties, you might be able to see nursing care plan in it. What they are observing, they are understanding from
they
either.
have followed all this, nursing.
That's right. Plan. She saw you. She saw you that you are going through a really vulnerable situation. She made a nursing diagnosis that she is vulnerable. She's probably excited, sad, tired, exhausted,
mixed emotions,
all the mixed emotions. She planned to be there for you. She planned to make you comfortable by the end of the day. She implemented her planning, her goals by being there for you and helping you out during the day, and then she evaluated. Now I'm hearing your evaluation as well, saying that it's been a few years now, and now that you're still remembering her.
Still remember that.
There you go. That's nursing care plan right there in a real life scenario. So that's good. So thank you, Jyothy, for spending this time with me and coming to this training session.
Yeah, I'm really, I just learn. Every day is a learning period, so thank you.
That's good. When you, I have also sent you a feedback form in your email. If you could take time to fill that out, it's not a big one. I'm not giving you.
Fill that up.
Yeah. Okay. Thank you. Thanks for your time.
Thank you.
Jyothy, there is also catering facilities available here. If you go from this room to the left side of this facility, you will find snacks and a cup of tea waiting for you.
Okay, that would be great.
What's your plan at the end of the day? Are you planning to? Do you have any other plans for this day?
I just have to go to the shop to get some grocery. That's it.
Oh, that's good. That's good. How many kids have you got?
Got one.
One kid.
Yeah.
Okay. Yeah, I have 2 kids as
okay.
well. Are they?
My son Joshua is 8-year-old.
Yeah, mine is 8-year-old and a 10-year-old.
Okay.
Yeah.
That's good.
Anyway, okay, but thank you. Thanks for your time, and in your busy life, you took time to
it's
come and
a good thing
attend
to,
my class.
Thank you so much for having me.
All right. See you later.